Hi. Going paperless with high user adoption. Doesn't anybody wants to reduce the paper workflows, but how? What are the hurdles to take and how to overcome them? In this real-life case, I'll try to show you how IDEWE implemented a personal medical dossier. And as a project leader, I walk with you through the project and indicate which factors have been crucial for a successful implementation. Usability, the integration, and above all, building an application for users that are less IT-minded. And in the end, I will show you how this application managed to allow us to optimize our processes, to gain on efficiency, and even to reduce our costs. But first of all, allow me to introduce myself and IDEWE. My name is Marc, Dewaelheyns. I'm a business projects manager at IDEWE. I was fortunate to be the project leader for this project. Now about IDEWE. IDEWE is about the largest health and safety organization in Belgium. We work on the health and welfare of workers in companies. And for that, we have several health assessments, occupational health assessments, and we work on we take actions against the harassment at the work floor. And besides that, we give advices. We are consultants and we give support about everything about prevention, about the policy of an organization, about the infrastructure. The companies are working with the installations, the materials, the substances they are working with, the hygiene, the environment, etc. Well, we are legally recognized for the whole Belgian country. We have a turnover of more than 65 million euros, and we offer occupational health assistance for over 700,000 workers in 37,000 companies a year. And we work with about 700 colleagues. Now, 700,000 people to follow, well, this means a lot of files, a lot of dossiers. You need a dossier for each worker, so about 700,000, and they're constantly changing. You need a company file for each company, 37,000 files. And, well, in shortly, all those files, all those dossiers were on paper. So you can imagine the time-spanning paper workflows that it costs. So we set up the PARC project. What is PARC project? Well, PARC is a project to digitalize all the paper files and even to automate some workflows. But of course, as in every project, we had our challenges. So the first challenge were the people. I told you we work with about 700 people, and as you can see, it's a very diverse public. We have engineers, but we also have doctors, we have nurses, physicians, and so. So, what was the problem? Well, over the past years, they had to deal with several new applications. And being not so IT-minded in some cases, well, they expressed their concern about having to adapt to another new application. So we had to find something for that. And most of all, many of the users are not exactly an IT-minded public. For instance, a physician, a nurse, well, their mind is focused on other things. Their work is focused on other things. They want to cure people. They want to prevent them from getting sick. And not, for them, IT is just a registered tool. So PARC wanted to make all documents available online for everyone at IDEWE who is authorized to have access to these documents. The second challenge was the integration with other applications. So very often users have to work with several applications at the same time. So they urged us to integrate Parc into the other applications so that they could have access, immediate access to medical dossier, to workers' medical dossier, just by clicking a button on that, the Parc button in that application they are working with. And they also urged Parc to communicate with the other applications automatically in the background to perform certain processes without them knowing it. The third challenge was a little bit as an organization. So what's in it for us? We can ease things, but do we save money by this project? Well, I think that we save money. We wanted to save money by simplifying the internal document flow, because it saved time, and time is money. We also thought to save money by reducing the archive space in our buildings, because a building costs a lot of money, and by reducing the archives, we would save money. And we also thought that we would save time by avoiding having to search for paper documents that were circulating, that were on the road. So, how did we do this? Well, we came up with Alfresco. We already used Alfresco in our intranet system, so we had some experience with Alfresco. And we focused on 4 points: the ergonomics, the integration, the security, and the training. Now, for the ergonomics, well, I already told you that our users were concerned about having to adapt to another new application. So we thought that it was essential to give our application the same look and feel as other applications. So very soon we decided to customize our front end and to build our own interface with it. We also wanted it to be simple. It was essential for them to have a simple system that was easy in use. We didn't want to have any unnecessary buttons, any unnecessary screens. We didn't want them to click twice when we could avoid it by clicking once on another button. So we also developed some robots to reduce the handling, to reduce the clicks to a minimum. And we also set up connections with other applications for automatic input of data. Let me show you some examples. Oh yes, I'm sorry. So this is Parc. And you could wonder, where's Alfresco in it? Well, fortunately, here's Alfresco. Parc is just the front end, but Alfresco is operating, and the intelligence is in the background in Alfresco. On the integration side, well, we had to provide in 2 integrations: the technical integration and the functional integration. So let me give you some examples. We have JAWS. What's JAWS? JAWS is our system and an application to register medical data used at the health assessment. So what did we do? Well, we realized an on-button integration as well as in JAWS as in Parc. So when you click on the Parc button in JAWS, automatically you open the worker's medical file in Parc. When you click on the JAWS button in Parc, well, you automatically open the worker's dossier in JAWS. But we did some things in the background because that was a question that also was required. So when opening a person's file in JAWS, well, JAWS automatically sends in the background a request to Parc to ask them whether there are any relevant documents for that worker in Parc. So Parc returns yes or no, and depending from that yes or no, well, the Parc button is enabled or disabled in JAWS. So that we would avoid people to click on the Parc button to ask for the documents for this worker, and then get in return, oh yes, there are no documents. Well, if you want them not to do so, just prevent them from clicking on the button. make it impossible for them to click on the button. So we were very pleased that Alfresco offered us the openness to integrate in that way. Another example is MISI. MISI is our system for administrative data of the workers. So we also developed an button integration as well as in PARC as in MISI. But we also developed a MISI robot. So what does the MISI robot do? Well, it imports the MISI workers' administrative data into PARC so that we could use them as metadata to add a document. So it's very easy. You just click on the integration button and all the metadata already appear concerning that worker. And once again, Alfresco offered us the openness to integrate it in this way. Concerning the scanning application, we work with Canon scanners. Canon scanners have the MIP 304 software that allows us to build our own interface on the scanner itself. Well, all documents are separated by cover sheets and scanned as one large document. So the document is sent as one PDF to Alfresco, and Alfresco splits the documents into all separate documents, which appear on the PARC screens. On the security level, well, we had to realize that we were working with medical information, so we had to be very discreet with it. So we developed some user roles in Alfresco, and we coupled them with our LDAP system, where all the users also had roles. So by doing this, we could define the user rights, and we could detail them to, for instance, a screen. It might be that one user sees a button which he's allowed to use on one screen, on a screen, while on the same screen, another user doesn't see that button because he isn't allowed to use that button. On the entity, for instance, the workers file, the company file. On the category, we categorized all our documents. The confidentiality level, we have 4 confidentiality levels. And also the administration tool, other applications that need authorization to send documents into PARC. For instance, JAWS is sending about 1,500 documents each day to PARC. Well, on the training side, let's say that we considered the project as being successful when the application would show out for itself. It has to be clear, it had to be obvious for the user. So we said, in that case, we don't need much training time because we want them to be intuitively use the application. So we only foresaw training of 1.5 hours until up to 2 hours, but that's the most that we did. And we started the training 1 day before going live. So people got their training, and starting from the day after, they didn't receive any paper documents anymore. Now, of course, you can imagine that we were a little bit worried about if it was going to work, but we already saw that after 1 month, we had about 23,000 documents into the system, and luckily we had very, very few interventions. So, conclusions. Did we succeed? Well, on the people front, yes, I think that we succeeded because we built an easy in-use application. We reduced the workflows. We set up a personal inbox for every user, and in that, the user has an overview of all the new documents that were meant for him. The documents are remotely accessible. They are immediately consultable from the moment that they enter a person's medical file. And they are immediately consultable by everyone who has the rights. And an advantage to the paper document is that documents can be consulted simultaneously by more than one person. And of course, there were no more lost documents that were circulating, that were on the road. We avoided it because we had our digital documents. Well, as you can see, we're working with it about 2 years. Now we are already reaching the 1.2 million docs, and it's growing by approximately 1,600 docs a day. We also had a satisfaction survey last spring about all our applications. And you see, as you can see, Park scored very high on the suited for the job, the training, the ergonomics. So people were pleased with the application. We scored a little lower on the speed, but of course the speed of an application often depends on the speed of their internet connection. Now, as we're doing health assessments, we're performing them very often at the client's location where we don't have access to an internet. So many of our teams have to use a mobile internet connection. And as we all know, a mobile internet connection hasn't the speed of light as we wanted it to have. The intelligence, well, we see that often users mix a document management system with a data system. So they expect everything from a document management system. They see, oh yes, I have here a document, but are these results also available then in JAWS? No, not all results are available in JAWS. These are documents. We tried out an OCR, but we discovered that in many times there was not enough information on the document to attribute it to a certain worker. So on the integration side, I think that we succeeded. I just explained the technical and the functional integrations with other applications. They're working fine. They're doing what you want them to do. So, did we save money by this project? What's in it for us? Well, I think that the efficiency has increased enormously. We reduced the paper workflows. Now, we don't have exact figures calculated by it, but I tried to estimate what we would save. Well, you know that we perform about 400,000 health assessments a year. So that's a lot. And for each health assessment, we had to go through that paper workflow. So I calculated if the paper workflow would only take 5 minutes per health assessment, we would save about 19 full-time equivalents. If it would only take 4 minutes, well, we still would be saving 15 full-time equivalents. 3 minutes, 11 full-time equivalents. If it only take the whole workflow 2 minutes, which is really nothing, because they had to get the paper dossier from the archive, take it with them, then afterwards put it back into the archive. Well, even when it should cost, when it would cost only 2 minutes, well, we would still be saving 8 persons. So, does this mean that we fired persons for it? No, of course not. But it allowed us, and it allowed them to focus on the things that were really important for him, to their core businesses, and no longer on handling documents. It allowed the doctor to focus on his health inquiries and not on document flows. So I think that we succeeded in it. Well, as an example, this gives you an overview of the document flow with a paper document. So look at the bidirectional arrows. So, and all this flow would appear about 400,000 times a year. Now with Park, it's very simple. A document enters Park, we attribute it to a personal medical file. Afterwards, we destroy the document. It's imported in Parc, and everyone can consult it. So we don't have to do any additional workflow to it. So we developed it with our Belgian IT partner, ACA IT Solutions. And I'm pleased to say, there are some of them in here, but I'm pleased to say and to mention that we were very pleased. It was a good cooperation, good working together. Well, they knew everything about Alfresco, about the possibilities from Alfresco, and also they understood our problems. I think that's very important because we absolutely wanted it to be adopted from our users. So this means that first of all we had to listen to our users. What do they want from it? What do they expect from it? And then we had to translate it up to our developers. So they managed to do well, and they understood well what were our requirements, what our people wanted, and they managed to develop a beautiful application. So that's about my story. Are there any questions? Yes.
3 questions.
Ooh.
How much time and money did you invest for the original project? How did you do the customer education? And how did you get the feedback, the survey from your customers?
Yes. So first of all, you asked how much time it took to develop and how much money it costed. Well, it took us about, I'm looking to my technicians, to the developers, I think it cost us about 6 months to develop it, perhaps a little more. 9 months?
How many people?
Huh?
How many people, just to give a rough idea?
2 people. But they weren't working all the time on the Parc project. About the costs, well, as they said, about 9 months. So I didn't look it up, but I think 150,000 euros. So it's nothing compared to the return that it gives us. So the second question was, how did we organize the trainings?
Yes.
Yes. Well, as I said, our main goal was not to organize any trainings, because our main goal was to develop an application that shows out for itself. So normally, we wouldn't expect people to have need of trainings. But of course, as you know, we organized trainings. So let's say that every quarter, people of our regions, we divide people into operational regions, come together in a meeting. So we used that meeting to give them a training. It was a training as I do it here, from let's say about 1 hour and a half, 2 hours. And because we didn't want them to have a training and then start with the project and with the product, let's say about 3 weeks, over 3 weeks or 4 weeks, because then we realized that they would probably have forgotten something about training. So, as I said, we gave the training, and a day later we started it.
May I have a follow-up? Did you think about in-application tutorials?
No. No.
Was there a reason for it, or just put it aside?
Yes, well, we built some health files in our intranet, but we didn't build it in our application, because we thought that, well, as I say, an application should point out for itself. And it did. Yes?
Hi, I understood that you developed custom interface. I haven't seen any use of BPM or similar workflow technology. Have you considered using a BPM under the hood, or it wasn't necessary, or can you comment on this?
Well, I think it wasn't necessary. Yeah? Our goal was to receive documents and to import them into the system, and then everyone could consult them.
So you don't have customized workflows, processes, and stuff. It's basically a repository of
No, that's
documents.
correct.
Okay, thanks.
Did you do some sort of mass or bulk upload of your old records, or are you just using this for new content?
Yes. Yes. As I said, JAWS, for instance. Well, we perform about 1,600 health assessments a day. So every health assessment delivers a document. So JAWS is constantly sending documents to Parc, and Parc receives them and classifies them.
I understand that, but when you started using this,
oh yes,
you know, the old records that you have.
Well, we thought about it and we thought hard about it, but we decided not to upload the paper dossiers. Now, does this mean that they didn't have anything to fall back on? No. So we decided to keep and to maintain the archive rooms in our regions, in our buildings, for at least 5 years, so that if needed, they could fall back on the old papers. And also, they were allowed to, if there were any relevant documents, if there were any documents that were really needed in the medical file, well, they could give it to the administration, and the administration would load them up. So that, well, if you look into a medical file, well, after some years, you'll see that there are many documents that are no longer relevant and that you have to keep for over 30 years, but they are no longer relevant in the current situation. So if they thought that some documents were relevant, well, they had the opportunity to load them up and even to consult them on paper. Okay?
Well, yeah, about 20 minutes. Good morning, everybody. I want to present our experience using Alfresco as basically a huge repository to deal with plenty of documentation. The case is, I would say, very similar to one of the previous opponents, but actually the approach has been a little bit different. First, let's talk about a little bit about Grupo Eulen. Grupo Eulen is a company which is pretty intensive in use of people. Our business is doing general non-core professional services. What does it do? This is cleaning services, maintenance services, environment services, ancillary services, security, temporary work, social health care, facility management, facility services. Those are our core business. We say that whatever is not core for a company is our business. The company should be concentrated in their own core businesses, and the rest could be outsourced to an efficient company. This is our business. As you see, we sell the services either one by one or all together, either for a sector or group as facility management, facility services. It's a very creative business. What does it mean it's very creative? It means that you don't get a customer which is asking exactly what the previous customer asked. For every customer, you have to do your own mix, which suits the needs of the customer. The customer knows what they want to do or know what they want or can outsource. Additionally, because it's very intensive in people, this sector is very regulated. It's very regulated, and it's also very dependent on two factors: where the service is contracted and where the service is delivered, which is kind of crazy. For instance, just in the case of Spain, when you contract somebody to deliver a service, you have to find out to which sector and to which place the service is being delivered. And for this, we got about 400 different options. It's not that we got the options, it's that the legal system in Spain forces you to have 400 different possibilities. So it's crazy, sometimes you cannot do it manually. And of course, not every, but could be depending on the service, depending on the sector, depending on the contract type, you need different documents. And you have to get the documentation ready, which is very ad hoc, and signed before the person starts to work. So it's a lot of paperwork. Just to talk a little bit about the company, we're present in 14 countries. I must say that 80% of our business is in Spain, but we're growing very quick abroad. And we expect in about 5 years to get 40% of our business outside Spain. Turnover is 1.3 billion, or 1,344 million, is a lot. 80,000 employees in the whole world, from these 55,000 in Spain, more or less. It's a zero missing, sorry. 8,000 customers sounds a lot. Well, as I said, every customer is different. We've got huge customers, big corporations, and small customers, which are a little shop that needs to be cleaned and taken care of and maintained. And we sign 150,000 contracts a year. I see some faces. Well, you say, how can it be that with 55,000 you sign 150,000 signed contracts a year? Well, it's the sector. Sometimes you contract a service, and then the service gets modified and adapted and adapted and adapted. Each modification requires you have to sign a new contract with probably with the employees. You get a single contract with the customer, but then your workforce needs to be adapted, needs to be added. So it could be that the amount of needed work increase or decrease, or is simply modified, or takes care in another place. Then you have to sign another contract, which is an ampliation, it's an increase of contract, modification, whatever, a lot. Which means in average is about 800 contracts a year. A lot of paperwork. And we get about 100,000 documents a month that we have to receive from the customers, for the employees, and process them, keep them under control, and be ready for inspections. Because one of the things that this business has a high risk. You cannot employ people who is not properly trained, who is hasn't got the proper protecting equipment, and also was not a proper contract, or is not duly and properly registered in the social security. A lot of things that you have to do previously before the person starts to work in a company, and you have to have this ready for inspection. So it's pretty much intensive. Some people say that our company provides services which are people intensive, very intensive in people. Each person that comes along brings lots of documentation, not just contract, but also curriculums, certificates, all the kind of things that keep on growing, growing, and growing. We get the paper, and for us, the paper is, to deal with paper is our main problem as far as IT is concerned. I used to say that our services are paper-intensive services, because per person you got a minimum of 30, 40 different documents that you have to track, you have to keep under control, and you have to have ready for everybody that needs to access to it. So, this is the business. As you see, as a summary, is very intensive in paper. Dealing with paper is very important, and changing from physical paper to virtual or virtualized or non-physical paper is not a big change, it's a huge change. Before, when we started this project, I was touring in Spain looking at the different branches, and they were full of papers. So, papers and papers and papers, tons of papers. After this project was implemented, paper vanished, disappeared. For the people involved, there was a huge change that you could see every day. But also not just that the paper disappeared, and same what our colleague said, is that the cost reduction was very good, but there was one thing which is not just cost, which is risk. The risk associated to not having the proper documentation ready also disappeared, because you knew you had it or you didn't have it, for instance. And because it's a very distributed system, it's not just that the customer or the inspection people know that the paper is there or not. It's also that the company knows if something is missing or is not missing, because as we will see later, for each different dossier, we had what we call mandatory documents. We had with the documents, we had a metadata that allows us to set up alarms and to generate reports of the missing things, and to also to inform the responsible people whether something missing or not. Which strategy did we use? We used a very conservative, very incremental strategy. We started in 2011, and we consider also always that platform, that Alfresco is not a product, it's a platform which offers many different options, and that you have to know the different options to be able to use them efficiently. You need good partners. You get a partner with a knowledge that allows you to use all those possibilities. We decided to settle for Alfresco. Why Alfresco? Because we started an open source strategy for the whole company, and we used to choose from in each segment, we used to choose what we consider is the better. And definitely we consider that for the document management branch, Alfresco was the best choice, and we still think this is. Also important for us is that we got thousands of potential users. We couldn't afford to get a system that is licensed per user. Why? Because we don't know how many users do we need. Sometimes we get 1,000 users, sometimes we get 100 users more, 100 users less. We couldn't deal with this changing situation if you have to get a system which is based on per user license. And also we decide to use Alfresco, the sites of Alfresco as the main user interface. Why? Because we want to set a standard. When you put in a big company, when you put a new system, a new application, one of the key points is the resistance of the users to use it. And as you say, if the users use it, if the users find it easy, intuitive, they use it. If they don't, they complain, or you get a lot of trouble because it doesn't fly as an application. We like the site, but also we were very confident that is Alfresco as platform who is going to improve the capabilities of the site, is the standard user interface, and this is what we tell our providers and our users. Once the user gets used to use a site, the functionality of a site, it can use all kind of sites. As you will see, we have created sites for all kind of things that we'll have a look. And another point that we use is that we wanted to do as few as possible customizations. Why? Didn't we have specific needs? Yes, we did. But again, using the concept of platform means that we are not developing Alfresco. It's Alfresco and the partners who are developing Alfresco as platform. It's kind of a trend. If you join the trend, you can upgrade with every different new options. If you do extensive customizations, it's very good for your users, but you are locked somehow. Next change, next new functionalities, you never know whether you're going to be able to use them or not, or how long it will take to do the migration. Basically, this approach was thought to avoid migration hassles, migration cost. And we started small and added new functionalities. Also, we started with small projects, and we ended with a big project. Why small projects? Because as a company, we have to learn how to deal with this platform. How to do it? Well, based on our experience, even if you start small with doing kind of incremental evolutive applications, from the beginning, you have to think of a single data model that encompasses all the needs of the company. We devoted about 3 months joining together all the users and going through the document needs of the company to put them in a single data model, corporate-wide, in such a way that in the future and in present, all the documents are going to be taken care of with the same standards. This is something that we strongly recommend because it pays later, because it really saves money and also problems. You have to know also that the data model of Alfresco is incremental. You can add new things in the future, but if you want to take out things which are already in the model, then you have trouble. So think of it, devote some time in the data model. You know it's incremental. Try to put everything inside, but also be modest. It's not, you're not sure about the kind of document type, don't put it inside, because then later on it's kind of rubbish. We come out with 51 document types. It's a lot, it's not. Don't know, it's simply what our company needs. We started at the beginning, the first attempt, it was about 80-something, 89, 90 documents, and then we kept on pruning and pruning. At the end, we were 51 kind of document types. Incremental, we defined standard metadata for all the documents plus ad hoc metadata for specific ones. So all the documents, the standard metadata is used for searching and for classifying, and ad hoc what adds new information to the documents. Specific cases. Every document has unique identifier. Every document has unique type. Any document has start, date, end date. Those are the standards, a few others. This guarantees that we can put this information, and for the searching criteria is very good. Every document has got also to who belongs to a project or not, because we're very much project-based. Every document has information whether it belongs to a specific person or not, or a specific section. Those are the standards. The rest, like if you go to a document title like invoice or something like this, well, you get amount, you get, say 5 minutes, sorry, I'm talking too much. Well, this allows to do a standard search procedure, let's say, and also we implemented automatic archiving. Nobody's putting documents into the system. You are putting your documents in a specific inbox, you tell the system which kind of document it is, and the system does the automatic renaming when archiving, in such a way that, in this way, we guarantee that all the documents follow the same standards and are kept in a homogeneous way. People doesn't need to know where to put the documents they put in the inbox. This is very powerful, very mighty thing, and also people is very happy with it because, well, it's magic. You put it somewhere, you put what kind of document it is, and this is automatically archived. Which functionality did we deploy? As I say, we deployed mostly sites, and the first thing we did is the corporate standard reporting documents. What is this? This is something that, as you know, in a corporation, when you are in different countries, you get a standard reporting things that every month, every country has to deliver certain things, specifically financial, but also clients, customers, marketing, et cetera, et cetera. It's a kind of internal standard, and then we put it in the Alfresco. The first thing we did, and this provided Alfresco with a huge visibility for the company. It's very small. We use a site. We use approval workflows, we use metadata, few things, but it was a complete success. It's been used by 14 countries, and that was the first thing we did some 2 years ago. No doubt, success. The corporate regulation management system, another site that everybody is using, we wanted to maximize the visibility of the system, to be sure that the system was going to be accepted. Documentation for providers, invoicing repository management system with approvals and so on. Long warranty repository and processing system. In this side, we did one extra step. We did integration with the ERP. In this way, when you start a service, you have to get certain guarantees from the bank that you are going to deliver this service, or you pay a penalty, which means you have a kind of loan. I'm not sure if loan is the right wording, but some legal papers you have to keep that had financial implications. Those things we kept in the system, and this is doing some summary and sending every month what needs to be sent to the accounting system, and also do some other calculations. Done from inside, it's pretty successful. And the last one, no, the pre-last we did is a system to handle the different steps a contract has to go through. For instance, to get a contract signed, you get 4 big steps. First, the contract has to be produced with a lot of ad hoc information. Very, very seldom we got 2 contracts which are the same. So a specific software which is outside Alfresco is being used to produce the different kind of contracts. This is sent to Alfresco as ready to be signed, and it's also digitally signed by the company in such a way that it's legally binding and it cannot be tampered, cannot be modified. Then the document is downloaded by the responsible for capturing the signature. The signature is captured, and the document is uploaded and stored in the proper place. It's a workflow application. The workflow we're managing with Alfresco, but we're not using activity, we're not using BPM, we're using kind of attribute-based workflow, or a very simple workflow. Why? Because we are not sure whether Alfresco is going to be able, not Alfresco, we are not sure that the sites in Alfresco are able to deal with 10,000, 20,000 live workflows. We have to do this testing before. And the last thing we did is the employee records management system. Every employee, the records, the documents, when I mean records, I mean documents, all the documentation of every employee is kept together in a single repository. It's a single site, and it takes about, it gets about 100,000 documents a month. This is the topping element. It's not just things which are very important for the company, but there are not too many, but with the whole paper, the 90% of the paper of the company in a single site, and is working properly. We had some performance problems. We had to move from version 3 to version 4. Okay, very quick. Next steps, what are we going to do? We want to do all those things. As you see, we don't want to do projects. We want to do incremental improvements on one we already have. We're moving to solar to performance, 1 minute. Where we have to get the information efficiently out of the system, business intelligence, business automation. We're integrating with other systems. We have to test, we like to test this hybrid on-premise, on the cloud implementation in such a way that we would like to capture all the documents distributed in cloud, synchronize with the internal system, and keep the documentation inside. What do we learn? Alfresco is a very complex, powerful platform. We have to learn how the platform works to use it. You have to know that this will be your standard documentation system. And takes time to learn how to manage. It's not just the database, it's a document management system with indexing, with searching, lots and lots of features. It's not easy to get, at least our experience, it's not easy to get a good administrator for it, because it requires a lot of knowledge. It's innovating a lot. What does it mean? It means that it's not a single product, it's a platform with different features. Some features are very straightforward at the beginning of the innovation curve, but some others are very, very new. Some of the new things do work, and some of the new things don't, or takes a while to get them working. So to find the right mix of the features of the first you want to use takes some time, and also you have to know in which area you are. For instance, if you use standard things, everybody's going to be able to use them. But if you want to use innovative things, probably you need to pick in the company the right people with the right innovation strength to do it, who is pulling from it. More things. And a third thing is that Alfresco's got a good community, got different communities actually. I think it's important that you know what kind of communities are and use the power provided by the communities. You get the community of users of the community edition, which is something very mighty, very powerful. You get the business communities, you get the professional communities. There are plenty of information. Each community is providing different things, and it's good to get close to the communities and know what they can provide you. Okay? Questions? Okay.